It's no secret that prescription drugs costs are on the rise, and some state representatives are trying to hold some of these big drug corporations accountable.
There was a big meeting held today to talk about their plans, but as WMAR 2 News' Abby Isaac tells us tonight, some in attendance had another agenda. And what was that agenda? What were they talking about?
Well, many people who were there are state retirees, so they had a lot of questions about the end of prescription drug coverage. Now, come January, all Medicare-eligible state retirees will have to be signed up for Part D, a switch that has caused frustration and confusion about rising costs. And they're not the only ones feeling the effects of prescription costs.
Some people can't afford college because they have to pay for their drugs.
Maryland Citizens Health Initiative held a meeting today at the Senior Center in Randallstown with state delegates and senators to address prescription affordability. AARP says the most popular drugs have risen by 208% since 2008.
And the generic drugs are mocked up over 5,000 times what they were worth and what you would pay in any other nation.
Many filling the room were state retirees, still looking for answers about the loss of their prescription drug plan come January. In some cases, the new plans cost much more than what they pay currently.
I would be bankrupt in very short order. I would have no assets, nothing whatsoever.
These state employees did their work faithfully for the state of Maryland. They need to be paid for what they did.
The state was going broke, and Medicare finally was including Medicare D, and we waited until they closed the donut hole, not knowing that all of the rest of this stuff would happen.
That stuff meaning price gouging.
Right now they charge whatever they want, gouge us, and have to answer to nobody.
The Health Initiative president went over proposed legislation to create a drug cost commission to communicate with drug companies about prices.
This drug cost commission will say to them, you have to justify why you're charging so much, and if you can't justify it, we're going to make sure Marylanders only pay a reasonable amount.
Something he says would address the underlying problem of rising costs that state retirees are facing. But with skepticism about how fast it would happen, they're calling for their plan to be reinstated.
It's frustrating, but I'm going to keep fighting, just like I did for the people of Maryland for 32 years.
Now, it's important to note that Governor Larry Hogan announced a one-year transition program to reimburse state retirees for costs over $1,500. Though that's created more questions about how fast the reimbursements will happen and how to file for one. There will be a joint hearing in Annapolis on September 13th where state reps will talk about Medicare Part D. Delegates at the meeting today said they're going to be providing busing so people are able to attend.